Hello and welcome to vlog number 57. Although I've had deep brain stimulation surgery and this has given me back my life through control of my most troubling symptoms, I'm very much aware that I still have Parkinson's disease and that it continues to progress in the background. I've noticed recently that my leg muscles have got substantially weaker over the last year, and I now have much greater difficulty in standing up from a sitting position. Obviously this is a worry to me, and I'd like to do something to help myself maintain muscular strength and thus my independence and quality of life. I'm seeing my Parkinson's nurse next Monday and I'm going to ask her for advice and to see if she can refer me for some physiotherapy. I'm very aware of the need to do some form of exercise because I'm continually reading about the benefits of exercise in relation to the progression of Parkinson's. I do get a little gentle exercise when I take our dog for her walks twice a day, but that is a far cry from the 30 to 40 minutes of aerobic exercise 4 or 5 times a week that seems to be recommended. My main issue with exercise is that I don't really enjoy it anymore. I have very little energy these days, and I really cannot see myself maintaining vigorous aerobic exercise for 30 to 40 minutes without collapsing in a quivering heap, let alone repeating that effort 4 or 5 times a week. My favourite form of exercise was downhill skiing, which I used to love, but now my postural instability problems mean that it is too dangerous for me to do it anymore. I just keep falling over when I try. New research, which appears in the Journal of Parkinson's Disease, finds that people with Parkinson's disease who maintained exercise 150 minutes per week had a smaller decline in quality of life and mobility over 2 years compared to people who did not exercise or exercised less. It couldn't be any plainer than that, could it? So I need to assuage my feelings of guilt and slow down the progression of my PD by getting off my backside and doing some aerobic exercise. I have a Nintendo Wii with balance board that I bought with the intention of using it to help with my postural instability. It sits in my lounge with its little red power light glaring balefully at me and hasn't been used since the initial honeymoon period, which lasted a couple of weeks. So perhaps I'll force myself to use that a couple of times or more every week. I also recently read about forced exercise being beneficial for PD, and it sounds ideal for those of us who lack energy. This involves, for instance, pedalling a powered bicycle, which enables the patient to sustain vigorous leg movement for far longer than they would otherwise be capable of. Research by Dr. J. Alberts, a biomedical engineer who specialises in movement disorders at the Cleveland Clinic in Ohio, had indicated that PD patients who followed an exercise regimen of intense and rapid leg movement for an extended duration on a stationary exercise bicycle showed a 35% improvement in their PD symptoms. So that sounds like something that I should perhaps be looking into. Swimming is another form of exercise that I used to enjoy, although probably not as beneficial as forced exercise, but at least it is something that requires no special equipment apart from a swimming pool. So that's another possibility to add to my exercise regime. I'll let you know how I get on. Thanks for watching. If you have any questions or have a topic that you'd like me to cover in future vlogs, just leave me a message in the comments and I'll do my best to respond. Have a great week. See you next Friday.